Apart from having issues with your hormones and having blocked fallopian tubes, there are some other causes of infertility in women that exist and people take less concern about them, something like undergoing a cancer treatment or what we call chemotherapy. In this video, I'm analyzing all the possible causes of infertility in women. There are many causes of infertility, and we try to classify these causes into 3 categories, and each category carrying own causes or own points that may lead to failure in conception. We have classified them into 3. Number 1, we have cervical or uterine problems. We have ovulation disorders. We have fallopian tubes problems. And of course, we have some other 2 major causes of infertility. And I will choose to begin with the problems that can be seen in the fallopian tubes. Remember, we said that the fallopian tubes plays a major role in fertilization because this is the place or this is the point where fertilization takes place. After there is a release of a mature ovum and there is ejaculation of a viable sperm, fertilization takes place in the fallopian tubes before the fertilized egg is transferred into the uterus for implantation. So, carrying in mind that a fallopian tube it's a very, very important organ in the female health, there are problems that can result from fallopian tube and lead to infertility. One of the major and main common problem with the fallopian tube is whereby you have fallopian tubes blockage. When we talk of the blockage, your fallopian tubes might be bilateral tubal blockage or it can be unilateral tubal blockage. What we mean by bilateral and unilateral simply means 1 and bilateral means 2. So if you have a bilateral tubal blockage or whereby your tubes are blocked, the 2 of them, then you will have issues with conception. When it's the only one fallopian tube that it is affected, then you are most likely to conceive. So one of the major problem with the fallopian tubes is whereby your fallopian tubes are entirely blocked. Another problem that we have with the fallopian tubes is whereby maybe there is a scar forming after you have undergone or after you underwent a medical surgery. In this case, it can resort to any surgery, maybe because of either ectopic pregnancy or a correction that was done on a previously blocked tubes. Any other cause of any other problem that's associated with the fallopian tubes, it's what we refer to as the pelvic tuberculosis. There are different types of tuberculosis. Majority knows about the normal TB, but we have some other types of tuberculosis. Among them, we have a pelvic tuberculosis that when you have these, it will affect the organs of the pelvic area that will result to infertility. Done with the problems with the fallopian tubes, then we have what we refer to as the ovulation disorders, or the problems that are associated with ovulation. As earlier I had explained in a previous video, I said that ovulation is a situation whereby a mature ova is released from the ovaries awaiting fertilization. So that process of releasing a mature ova from the ovary is what we refer to as ovulation. So in this case, ovulation can have own disorders that may lead to infertility. One of the most common problem of ovulation that have continued to result into infertility among many women, it's a condition that we refer to as the polycystic ovarian syndrome. In short, we term it as PCOS. Remember in a previous video that I had done, I explained that the polycystic ovarian syndrome is the presence or is a situation whereby the normal ovary contains some other numerous numbers of tiny ovaries in it. So when there is this issue with the polycystic ovarian syndrome, there is always, number one, there is either cut of responsible hormones, or there is also problems with an ovulation. So if you have this condition, you are most likely to suffer from infertility. Any other problem that can result from ovulation disorders is a condition that we term to as the premature ovarian insufficiency. Remember, when a newborn female is born, there is always a number of available ovaries that woman will use for the rest of her life. In other words, what I'm trying to mean is this: when a female newborn is born, she is born with an ovaries that she will use in her entire life. So in most cases, there can be an issue, or there can result this premature ovarian insufficiency. So this premature ovarian insufficiency can be triggered by either it can result from the genetic problems, it can result from another thing. It's one by we have issues with the environmental attack. What we mean by environmental attack, this is the presence of anything that can lead to suppression of the number of ovaries into your body. And one of the most leading cause of ovarian insufficiency is the cancer treatment or the chemotherapy. If a person has undergone chemotherapy for a longer duration of time, this person, it's a higher risk of suffering from premature ovarian insufficiency. Another issue that is related with the issues with the ovulation, it's whereby a woman produces too much of prolactin hormones. Prolactin hormones, in most cases, it's used during milk production. So when there is a lot of prolactin hormones, this leads to low production of estrogen. We have also another problem that is associated with the ovulation disorders that we refer to as hypothalamic dysfunction, or in other words, the inability for the hypothalamus to work properly. In this case, I will try to explain this and to expound it using the two responsible hormones for ovulation, and I will talk about the luteinizing hormone and the follicle stimulating hormone. So these follicle stimulating hormones, it stimulates these follicles to rupture so that they can release the ovary. And we have the luteinizing hormone that helps in transportation of the egg from the ovary into the fallopian tube. So if there is this slant action of the hypothalamus, then there will be no enough production of the luteinizing hormone and the follicle stimulating hormone that are responsible in making there is a rupture and transportation of the egg, and in that case people will present with infertility. We are already done with the problems of the fallopian tubes. We are done with the problems of ovulation, and we also have the cervical and the uterine problems. What we mean by the cervical, the uterine problems, this is whereby you might be having issues with your cervix, you might be having issues with your uterus that can affect your potential of getting pregnant. The most problem, or the common problem that you are most likely to get either into the cervix area or into the uterus area are like three. One of it is it's a fibroid. But not every fibroid that may result to infertility, because there are people who have had fibroids in them and they still conceived and they give birth to a viable baby. So one of the main things that can result to infertility as a result of fibroid is if there is an overgrowth of this mass. So if it's affecting the inner side of the uterus or the endometrium. So this is whereby in most cases fertilization will take place, but implantation will fail. So if implantation fails, then automatically there will be no growth of the normal fetus. Another issue, it's whereby you have problems with your cervix that we refer to as the cervical stenosis, or in other words, the cervical narrowing. The cervical narrowing may affect the transmission of the sperms, because after ejaculation of the sperms into the vagina, these sperms must swim all the way from the vagina directly into the cervix so that they will reach the uterus for fertilization. So if there is this excessive narrowing of the cervix, it will block the penetration of the sperms after ejaculation. So if there will be no penetration of the sperms through the cervix into the fallopian tube, this is also another thing that will result to infertility. Another issue with the cervix, this is it's one by the cervix produces or releases an abnormal mucus. Remember we saying that the cervical mucus is supposed to be thin and slippery so that the sperms will be able to swim direct or will be able to swim through until it reaches the fallopian tubes for fertilization. So if it happens that this cervical mucus is thick and not slippery, what will happen is that after the sperm has been ejaculated, it will not be able to swim through. And in most cases, they die at the entrance of the cervix, that will result to inability of these sperms to reach the fertilization, and hence infertility will result. Another problem is whereby we have a condition that I already talked about that we refer to as endometriosis. Endometriosis is a condition whereby the tissues that are normally found inside the uterus are outside the uterus. These tissues might affect the fallopian tubes. They might even affect the ovaries, leading into infertility. Because if these tissues affect the fallopian tube, they may result into blockage. We have another rare condition we refer to as that Maillard-Rokitansky-Hauser syndrome. This is a condition whereby the females are born without their reproductive organs. In most cases, females are born without the uterus. Others are even born without the vagina, and we have to create an artificial or vagina through surgery. So in most cases, people may have this condition that we refer to as MRHK syndrome. So if people are having this syndrome, they does not have the uterus, they does not have the ovaries, they does not even have the cervix. There are some that can have the vagina and they lack the uterus and have some other organs. There are other people who still lacks everything. So this, when you have these conditions, first sign, people with this condition does not menstruate. So this condition is also another thing that can result to infertility. We also have another cause of infertility, and that is where you have hormonal imbalances, or you have problems with your hormones. For you to get pregnant, every hormone must play its role perfectly. So if on the process the hormones fails to play their role, you are most likely to suffer from infertility. The good thing is most of these conditions can be treated. If you have any question, kindly ask it into the comment section and I will be very willing to assist you. I request you to like, comment and share, and also don't forget to subscribe.